All right. Depression is a mood disorder that causes persistent feelings of sadness and loss of interest. Depression affects 1 in 10 Americans. Recently, I read up on a study on depression that said Americans who are not affected by it think you can just feel better. The thing about depression is it isn't just a feel better type of illness. It's a serious mental illness that most of the time requires a lot of medical attention. Some of the more noticeable symptoms of depression include feeling sad or anxious, feeling hopeless or worthless, not enjoying the things you used to, such as your sports or your hobbies, sleeping too much or too little, appetite changes, gain or loss of weight, and thoughts of suicide. The first huge step in helping recognize that you have depression is talking to someone that can help evaluate your thoughts and feelings. See, the thing about depression is, when you do have it, you have all of these thoughts that overpower you and make you feel so little compared to anybody else. These thoughts turn into great amounts of anger. Your strongest emotion is anger. It's the one emotion that can take over you. So when you talk to a professional and seek the reasons why you feel this way and where these thoughts come from, you can find a better way to let out your emotions and a better way to deal with them. The causes of depression can be biological differences, where people with depression appear to have physical changes in their brain. It can be your brain chemicals. So the neurotransmitters in your brain, they play a huge part in depression. And research shows that the changes in these functions of these neurotransmitters and how they interact with the neurocircuits in your brain, which are involved in mood stability, they play a huge role in depression. Hormones, such as a change in the balance of your hormones, so for example, during pregnancy or menopause, or inherited traits. And it is proven that when a blood relative or someone closely related to you, such as your mom or your dad, has had depression, you are more likely to develop it. Some risk factors of depression are having low self-esteem or being extremely dependent on somebody else, traumatic events such as abuse, parent divorce, or a family member death as a young child, and relatives with a history. Also being gay, bisexual, or transgender, specifically because it sets you out from the rest of people, a history of other mental disorders, a history of drug abuse, chronic illnesses, or medications. There are many ways to prevent depression. A few are taking steps to control stress, whether it be through talking to someone, journaling, or working out, or reaching out for help, getting treatment from a professional, and maybe considering a long-term treatment facility. Treatments are different for everybody else. It's just based on what you prefer and what helps you not think about the thoughts that you do. So there are many ways to also combat depression, such as aerobic activities, sports, hobbies, therapy, engaging socially, or for some, it could just simply be turning on a funny show or movie. There's a therapy called mindfulness-based cognitive therapy that can have a positive effect on preventing relapse in recovered patients. The therapy teaches individuals mindfulness skills, meditation, or deep breathing exercises, which greatly decrease the risk of recurring depression. And this process helps patients regulate as well as tolerate their emotions that they normally couldn't. There has been many call center facilities put in place for people with great feelings of hopelessness, and that gives the depressed individuals the chance to talk to someone. And this can be effective because there is a higher chance for someone to speak and reach out. If there isn't a face-to-face interaction, they have an easier way or an easier time talking about their issues. And this is a great method for school-age children because studies show that depression affects young people. It affects 1 in every 33 children and 1 in every 8 adolescents. And the number of students needing psychiatric med has increased 10% in 10 years. And the goal of these groups in the call center facilities is to reduce the risk of suicide amongst children and young adults. All right, that's the end of my speech. And then these are the people who I'm presenting to. And my cat too, that's my third. All right.